economy, and so far in our inquiry we've seen that the regulation of non-surgical cosmetic procedures is fragmented and differs across the country. So today we're looking at the case for licensing and what can be done to improve the legislative and regulatory regime around beauty and aesthetic practices. So before I introduce the speakers, I'd like to remind everyone that this session is being recorded and the recording will be made available online. So in this session we'll be hearing from Sarah Clover, Barrister at King's Chambers; Charlotte Rose, Senior Environmental Health Officer at Wolverhampton Council; Tamara, Sandoul, Policy Manager, Chartered Institute for Environmental Health. So I'd like to thank the speakers for joining us today, and I'll let them introduce themselves and then we'll open up to the rest of the members for questions. So first, if I can welcome Sarah Clover, and Sarah, you've got around 3 minutes, please. Thank you.
Thank you very much indeed. Thank you very much for having me. Yes, Sarah Clover. I've been a barrister for about 27 years, and in most recent times I have been a specialist in licensing of all types and descriptions. I'm based in Birmingham at King's Chambers. I'm also on the board of the Institute of Licensing. We've been doing some work recently with the Chartered Institute of Environmental Health. I know you've got Tamara here, and I've also done some work with Charlotte Rose. In brief, just addressing the questions that the APPG has set around licensing and what the current state of the law is for cosmetic treatments and aesthetic treatments. My message really is that it's very chaotic and inefficient, and really the time has come, in my opinion, to address this in a wholesale way. The systems are not uniform across different parts of the country. There is a scheme of registration in most parts of England, but a scheme of licensing in London, and that is not working in a nutshell. The different types of treatments that can be addressed under either the registration scheme or the licensing scheme are different. They've not been brought up to date. The system is not future-proofed in any way, and modern treatments are left pretty much outside of the current regulatory scheme, and these can be some of the most dangerous. There's very little, realistically, that local authorities in most of England can do to maintain standards, either for premises or for practitioners. They've got very little control over training, and the time really has come, as it has with other areas of licensing, such as alcohol, gambling, animal licensing, for this particular area, which has impacts on the public, to be brought up to modern standards using modern methods of regulation, which we're very experienced and capable of doing. I do believe licensing is the best way to address and tackle this. We have some models that we can very usefully use, and this is one of the things that we've been discussing between the Institute of Licensing and the CIEH as to what a modern scheme of licensing for beauty and aesthetic treatments would look like. There's a great deal that can be done. It would involve primary legislation, so that is something that's going to have to find time in due course, but for the purposes of this APPG, the work is vital, it's very timely, and we're very pleased to have the opportunity to contribute, and I'm very grateful for my invitation to assist. And I think I can leave it there. Thank you.
Thank you, Sarah. Thank you. And I'll ask everybody to keep their questions till we've heard from all three of our speakers. So I'd now like to welcome Charlotte Rose. Charlotte.
Hi, thank you for inviting me today. I'm a Senior Environmental Health Officer for City Wolverhampton Council. I have a lead role in special treatment and better regulation for non-surgical treatments on the high street. I have a vast amount of experience in complex investigations, working alongside Public Health England and police colleagues in high-profile cases, which include the Dr. Evil investigation. I've been working closely with Public Health England in relation to better reporting for bloodborne viruses and skin infections, from the route of members of the public through to GPs, then better reporting to Public Health England and local authorities who are currently enforcing on the high street. I also am a member of the West Midlands body piercing group, and also chair of the new subgroup that has been put together for licensing for special treatment on the high street. And that's how I've managed to engage with Sarah. I can give you an oversight into current remits and provisions that we have as an environmental health officer, how it differs between different nations, and how it's very difficult for environmental health officers who don't have licensing regimes, and how we have to deal with intel-led investigations, how difficult it is for us to enforce. And in particular, we've found it quite difficult to be able to act efficiently in terms of dealing with risks on the high street that are serious enough to cause injury. I can go in detail further on in terms of what treatments I think should be regulated via a licensing scheme. I can give comment on powers in terms of what they're currently using. And I do have and have been working with other officers across the Black Country for suggestions for licensing, including premises and practitioners, for a safer high street.
Thank you, that's really interesting. And if I can now ask Tamara to speak. Thank you.
Hello there, thank you for inviting me. I'm the Policy and Campaigns Manager at CAH. We are a professional membership body for environmental health. And I will just briefly give an introduction to the work that we've done in this area. So last year, as Sarah mentioned, we carried out a survey focused on regulators who work in this field, together with the Institute of Licensing, and we published our 2 reports last month. Now, both environmental health practitioners and licensing professionals regulate some of the treatments offered on the high street, and we therefore wanted to see what intelligence we could gather on the ground, what kinds of issues regulators are seeing, but also we wanted to use the survey to test some of the policy proposals. So a lot of what I will say today will be informed by our work on the survey and what we've heard from regulators. Now, whilst I appreciate that the APPG inquiry is limited in scope to just a few cosmetic treatments, I'm here today to try and convince you to make recommendations that are wider than that, and that cover a greater range of treatments. At the moment, different cosmetic treatments are subject to a range of regulatory regimes and a range of legislation, and this varies by locality, and this inconsistency means essentially that different standards apply to different treatments in different areas, and different regulators are responsible for different treatments, and that means some fall through the cracks completely. Nobody is responsible for regulating them, and this is especially the case with new treatments emerging on the market. And what we've heard from the regulators is that there are a range of very serious kind of examples of infections, injuries, scarring, burns, allergic reactions as a result of a range of treatments which are not just injectables and Botox and fillers, but also things like ear piercing, lasers, and a range of other types of treatments. And I guess our key recommendation is, as the title of this meeting suggests, is for an England-wide licensing scheme. And I hope to go into a bit more detail about how we believe that could work well. But alongside that, we also feel that better data gathering and reporting is essential to support that. The Department of Health and Social Care should be collecting some data on how often and what kinds of things go wrong when these types of treatments are carried out, so that we can at least compare where we are now and where we need to get to. And also we need to raise public awareness and have a database or a register of all licensed practitioners, and a central point where members of the public can report adverse effects. So I think that the licensing scheme needs to kind of work alongside those 2 things, and I'll leave it there.
Thank you, Tamara. Before I open it up to questions, I'll just ask one myself, which is, I was very interested to hear from all of you about, I mean, can I just say that when me and Caroline first met you, Sarah, we were quite amazed at this whole field of licensing and just how there wasn't effective licensing in England. So you've all mentioned about the need to reform licensing, and what I'm trying to say, I suppose, is how can legislation, with every emerging, with it's always some new treatment coming along, how can legislation keep up effectively to make sure that we have regulation throughout the industry, because it seems that it's always very, very different and it's always changing. And what greater powers do you need in terms of local authorities to enforce a more effective licensing regime, and would you need corresponding monies? So 3 questions there, sorry.
No.
And if I can start off with Sarah.
Yeah. One of the questions that you had in your sheet was effectively why a licensing regime, which I think is the context for the questions you've just asked. And I think licensing really is just a label that you put on a way of controlling activities that have impact on the public. And that's why we have licensing schemes for lots of different types of things, ranging from alcohol to firearms to taxis, you name it, that they can all come under this label of licensing, because licensing is really just about what is the activity that impacts on the public? Is it something that the state should have a role in regulating? What's the extent of the role that the state should take in regulating activities that otherwise people should be free to do on their own account? How far should they restrict that? And what is that based on? That's based on impact, negative, harmful impact. So music is a good thing, but when it becomes noise affecting neighbours, it has harmful impact and you license it. Alcohol can have pros and cons, but it goes too far and it has a harmful impact on members of the public, on children. And so these are the watersheds, these are the lines upon which we intervene to regulate, that the state says that far but no further. And licensing is just the label that we give to how we do that. And generally speaking, the way that you do it is to identify the activity and identify the harmful impact. And that's what you do with beauty, cosmetic treatments and aesthetics. You define them, and this is going to be the challenge, but we've already started on this. The IOL, the Institute of Licensing and the CIEH have got a working group looking at this already. And the way you do it is to define your licensable activity around the impact widely enough that something new coming on the market will slot into one of those predefined activities. And what we've been looking at is how do cosmetic and beauty treatments split up in that way? And it's broadly along the lines of piercing the skin, or changing cell structure through light, or changing cell structure through heat, or chemical intervention. And you can start to divide activity up in that way, define your licensable activity in that way, and that's the way you add new ones.
Right.
That's how you future-proof it. So that's the way we've been thinking. It's entirely doable, but one of the questions was, are there best practice out there already? Can we effectively tinker with what we've already got? And the answer is no. Mm-hmm. This is going to have to be a white piece of paper, a start again exercise. Rather than adding wheels on, wheels off the current vehicle, we need a new vehicle.
Okay, thank you. Thank you. And if I can ask Charlotte next, please. You don't have to, and Charlotte, you don't have to answer all of those questions, just answer the ones that apply to you.
I think from a frontline officer myself, I mean, I'll mirror what Sarah was saying. For us, it is, we need greater powers to be able to act quickly and be able to deal with the new emerging trends, which would fit into the different categories that Sarah is currently looking into. For us, it would be very, very similar to almost like the food hygiene rating approach and how we risk rate food businesses. So we would give each category and each treatment, we'd give it an assessment which would include competency of the practitioner, suitability of the premises, which would then dictate how we risk rate that premises and how often we engage with the business, which would give us as officers greater powers to be able to enforce and deal with that particular individual who's carrying out that particular invasive treatment. I can't really add anything more to what Sarah was saying, to be honest.
Can I ask you, do you think that local authorities have adequate funding to be able to have an enhanced and proper enforcement role?
Not at the moment.
Not at the moment. Okay, thank you.
Madam Chairman, if you don't mind me just coming back on that point, the way most licensing regimes work is to have a licence fee. It's usually self-funding. So the people who want to buy into the scheme and the system by having a licence will pay the local authority a fee for doing it, and the fee covers the cost of investigation and checking and enforcing and all of those things. And that's typically how it's done.
Can I ask you then, and I'm sorry, I'll come around, and I know that I'm hogging it a bit, but can I ask you how that would affect mobiles, you know, people who deliver these treatments as a mobile operation?
How would a licensing scheme operate? Well, there would need to be some minimum standards. It's not impossible to have mobile premises. We see an element of that under the Licensing Act 2003, but they would have to meet certain standards of hygiene, which might need to be bespoke to a mobile unit. But mobile units and home visits are amongst the most problematic areas of the system that we've got currently, and pretty much fall outside of any realistic regulation. So they certainly need to be drawn in. It's quite a specialised area.
Okay, thank you. And Tamara, your thoughts, please.
Well, I think some of the points have been covered by Sarah and Charlotte, but I guess I would just like to say that when thinking about this, a licensing scheme would be an improvement on registration in a number of ways, as I'm sure you know, which briefly are that it would cover all treatments, so you could take action on all treatments, not just 5 treatments. It would be future-proof if we can design a system to do that, which we would have to. It would cover mobile and home working practitioners. At the moment, local authorities don't have powers to enforce in this area, and health and safety executive do this, but unfortunately this is not a priority for the health and safety executive. They deem these kinds of treatments to be low risk, so I haven't heard of any investigation by them in this area. And of course a licensing scheme would be underpinned by effective standards and conditions, which the registration regime is not. All practitioners would need to meet these conditions to operate. This would of course be easier for the practitioners as well as the regulators, I think, to have a consistent system across the whole country. But one of the kind of more worrying kind of trends that we've heard about in our survey is just the lack of ability to set educational standard requirements for practitioners performing the treatments. And what a licensing scheme could do is require some kind of regulated qualification from an accredited training provider, and possibly also standalone level 2 hygiene and infection control qualification, which is what they've done in Wales as part of their licensing scheme.
Thank you, Tamara. Caroline, do you want to jump in? A mention of Wales, and that's enough for me.
I mean, Wales got it right. Yeah. A couple of things really to the 3 of you, and just jump in whenever. How big an issue is this?
Well, I might jump in quickly and just say we don't know how big an issue it is because nobody has gone out to collect the data. We've done some secondary research which is available in our reports, where there have been some studies done on this. But essentially we don't know how many people take part in cosmetic treatments, we don't know how many people for whom it goes wrong, we don't know how many people are hospitalised or have to go to the doctor, because there are different routes that members of the public use to get help, and they're not always fed back to PHE, and they're not always recorded.
So how much are the public aware of this? You know, Sarah's talked about the problems with gambling and alcohol. I mean, Sarah, you may or may not know, but gambling regulation is a huge thing for me. And having been involved in that world for a couple of years, the cases that I get seen on an everyday basis are quite phenomenal. I don't think there's a day goes by when I don't get half a dozen cases of problem gambling. I want us to be at that stage when we are getting notifications about this subject, because if we're getting people writing to us, then we are getting through to the public that we are trying to do something and that there is hope, if you like. But you know, how far are we from the general public knowing that there's somewhere to go, someone like Sarah, someone like Charlotte and Tamara? Because I get the feeling a lot of people don't really understand what's behind the industry, or what the industry should be doing, or what they're not doing that they could do. Do you know what I mean?
Yeah. If I can come in there, I think that's absolutely right, and I endorse what Tamara said about there not being much data, but we have very strong suspicions that we're seeing just the tip of an iceberg. And the proliferation of beauty treatments, aesthetic treatments on the high street is great and growing. It's a big sector of the economy. It's a developing sector of the economy, which is not a bad thing in itself. But you can see the number of shops that pop up on the high street, probably more so pre the coronavirus crisis, but there's a huge development in this area, huge demand for it, driven by social media, cultural trends, young people trends, and so on. So there's a huge demand for it. I think the public are very confused, but if you look at the nature of the regimes that we've got and the fact that the professionals are confused about it, it is hardly surprising that the public are confused about it. They wouldn't know who to complain to, whether it's worth complaining. There are a number of campaign groups that people can complain to, and we have seen an increase in the number of complaints, but probably not representative of the number of times that things are going wrong.
Yeah. I mean, we buy with our eyes. We all buy something if it looks nice, and social media is the place where people are buying with their eyes. I really worry that people on there are given this impression that what they're offering is purely, you know, it's going to be wonderful, dreams are going to be answered, it's perfectly legal. They're not, and half of these people are not trained. So I suppose, Charlotte, at this question, how do we tackle that, given the fact that a lot of trading standards are already decimated? And also for you, Charlotte, how proactive are other local authorities? Because I don't think my local authority prioritises what you do. I mean, I think it's horses for courses then. In Swansea, we've got a massive issue with counterfeit goods and fulfilment houses and spice, and their focus, because there's 3 people working in an office. They seem to specialise in that. I know that, I think it was Nottingham, were looking at the Whirlpool tumble dryers, and they were looking at all the Whirlpool problems. So how do we get to a place where we have a dedicated space for trading standards to be looking at this professionally, apart from yourself, Charlotte?
Yeah, I mean, it varies across authorities, but I mean, certainly where I work, and I'm sure it definitely across the West Midlands, it is predominantly environmental health officers who would deal with this, and not trading standards officers. We have done some projects through Intel, and that is how we allow the public to be made aware of current issues that we have, and that's through working with the CIH, giving local media alerts, social media. But unfortunately, what happens, what we find is that we only get to know, and the public only get to know, who deals with the issues when it fails. Yeah, so you know, you'll get your complaint that comes through because someone suffered 2nd-degree burns, or they've had a skin infection because they've reported to their GP, or they've taken a private claim. It's not successful, and then they've referred it back to environmental health to deal with it. And sometimes it's often too late. It's a hard one for us, and I've been working very closely with public health to pick up on this, to make sure that we do campaigns, we let the public know. We always promote the use of the JCCP website. We ask people to use practitioners that are competent. And equally, we also ask practitioners in our area to engage with the likes of the JCCP to look at how they themselves can become better and more competent in how they are and better trained. Because unfortunately at the moment there are a lot of training schools that are not official training schools, and it's a lame person who's previously been working as a builder who wants to go into special treatment, has completed a £500 2-day online course, has got no previous experience, and is now on board with emerging trends and wants to create this whole new training school.
I think we pandering to people's vanity as well very often, aren't we? So, I mean, some of us will look in the mirror and think, oh, and I don't necessarily think that the people, a lot of the women, and it's mostly women, although men do have treatments, who are actually buying into this are going to do any of the research. They'll see what they perceive as the end result, and they want to be like that. We're all searching for perfection. Obviously, I don't think the press help, because they always give this portrayal of everybody having a perfect figure and perfect skin and everything's perfect, and in the real world it's not like that. But if this was something which was affecting elderly people, like scams, then it would be out there on mainstream TV. You'd have all the consumer programs looking at this and saying, don't reply to this advert, you know, be aware of scams. Now, why aren't we doing more around that messaging to alert people that this is probably one of the best examples of what you see is not what you get?
If I can just come in there, it's very difficult because the nature of the activity in itself might be good or it might be bad. So whereas a scam is always bad, a beauty treatment done well can be a positive thing. It's not similar to alcohol or riding in a taxi. Done right, it's a positive benefit. Done bad, it's a harmful impact, and that's the challenge. That's the thing. You don't want to stop it. It's actually a good local and national economy driver.
I agree, but how do we get to the point where we have got rid of the bad and we've only got the good? I mean, what is it that we can give to the good? I mean, at one time I would have said like a kite mark thing, but how many people are really going to take any notice of a kite mark thing? Oh, is that a vote, Jude? No, no. No, it's okay. I thought it was a vote.
This is why licensing is so good, because you take the responsibility away from the public to a certain extent. They can have the confidence that when they approach premises or approach a practitioner, they know, or they don't even need to know, that it's been quality controlled, and you give that quality control to the people who know what they're doing with it, which is the regulators. And so before you access the market, you have to go through that gatekeeping process, which is held by the regulators. And if you fail to go through that gate, you're committing an offence. And there are powers to deal with that. And then the funding is there through the licensing scheme. Local authorities to get proactive, to go out and look for those who have failed to go through the gatekeeping.
So why is there so much resistance to it all? Why are sort of some people in the industry so dead set against this?
I don't know if they're resistant to an improved scheme. They might be resistant to their part within it, or how the scheme would regulate them, because they may feel that it's holding people out of the market who should be allowed in, or they're having to have more training or more standards imposed upon them than they would want. And you get that in other licensing regimes as well. You get taxi drivers saying, why should I have a car of that quality? It's going to cost me so much money. Or pubs saying, why do I have to have so many security staff? I don't think I need them. And that's the fine line of deciding where the state draws the line and says, that's the standard you have to meet. So there will be arguments about that. I don't think it's necessarily an argument about the overall scheme in and of itself.
Okay.
So can I ask a follow-up question to that, which is, should a mandatory national register or licensed practitioners be established?
I'll just say very quickly on that, because I think Tamara's already referred to it, but in the Licensing Act 2003, so alcohol regime, there's been quite a lot of resistance from government to a national register. The regulators would like it. I don't know if the operators are particularly resistant, but government's always said we don't need a national registration scheme. I don't think it's the be-all and end-all, personally, because I think it's the local regulation that counts. But if I defer to Tamara, because I know she has mentioned that she would welcome a national registration scheme, I'm kind of neutral on it.
Well, I think that a register of practitioners who have been vetted by a licensing scheme, so effectively they have their license, is the natural next step from a licensing scheme. You know, you should be able to go online and to check whether somebody has met the conditions and requirements to practice. So I would totally agree that that's what's needed. But just to kind of go back to what Carolyn was saying earlier, you know, we need a really good awareness raising campaign with the public from, you know, people like Public Health England or whoever they may be once that's dissolved. You know, they've done so many awareness campaigns on health issues, but this has been absent. You know, I haven't seen a major campaign to tell members of the public where to go. Now, the government also set up the Joint Council of Cosmetic Practitioners, which is a voluntary register. So presumably they would be in favour of a register because they've already set one up. It just happens not to be mandatory.
Okay.
I would agree with that, with Tamara. I think that would also give better informed choice to the public. And I think, especially more recently, where we've had a lot of issues with not having details of close contact services during the pandemic, because we moved away many years ago from visiting premises of that nature. So we're finding at the moment that due to the pandemic that we are seeing an increase in premises that we weren't aware of. They're equally creeping up to the numbers that we have of restaurants, licensed premises. And I think if you can have a register where, similar to the food hygiene rating scheme, where you've got a list of businesses that people can go out to and have a treatment, and they know that the local authority have had some engagement with that business in particular, to allow them to make that choice as to whether they should visit that particular premises or not.
I can only say that, you know, from my experience of, like you said, the food hygiene, from time to time our local paper will just print the food hygiene ratings of various takeaways and restaurants, and everybody looked at it. But I think it is about making it accessible to people, isn't it? And in terms of will a licensing regime license people, premises, or both? And it's going back to that mobile question. I'm just intrigued as to how this would operate, because otherwise that is a big segment almost of the beauty industry that operates under completely different regulations. Is there any way that we could have some parity right across both?
We've been looking at this in the working group, because there are a number of models that you can use. The gambling regime has operators licenses, and taxi for that matter, operators licenses and premises licenses, and then individual licenses in some cases as well. The alcohol and music regime just has premises licenses and individual licenses, personal licenses. And so far we seem to think that the preferable model would be to license premises, because then you can get the structure of the building and the hygiene and the infrastructure, the plumbing and the electricity and the cleanliness and all of the things that you need that are integral to that building, no matter who is in it. And then we thought a personal license of some description to the practitioner that matches with the skill set that they need for the particular treatment that they are offering. So that's going to be a little bit more complicated. So service of alcohol is a much narrower set of criteria that you might need before you can serve alcohol. the beauty and aesthetics industry, it's going to have to be much more nuanced, because people are going to need to be trained in the right practice, in the right licensable activity, but it's entirely doable, and that seems to be the preferred way so far.
Anyone else on that? Charlotte?
We would, our opinion here in the Midlands would be that you would have a practitioner and a premises. We've had discussions around the mobile practitioners where you wouldn't permit certain mobile treatments to take place anyway. There would be an exemption list. For example, there are Botox filler parties that are happening in 1 Smith Street with no controls in place in the premises. It's an unsafe environment. And I think what we need to remember is it's not just about the practitioner, it's about making sure that they're carrying out an invasive treatment in a safe environment.
Absolutely. Tamara, do you want to come in?
I just agree. I think both are important, but yeah, the premises needs to be safe. Even if someone's working at home, they need to set up a safe environment where there's adequate hand washing facilities, where they're disposing of things in the right bins, you know, for sharps and potentially infected items, and there's no soft furnishings and everything being disposed of between clients. So the premises and the way that operates is really important, but also the training and qualifications of the practitioner are also really important, because, you know, they're in some cases with some of the treatments, getting it wrong can have an altered body altering kind of consequences, where you're injecting things into someone's face essentially.
Carolyn, have you got anything to say?
No, I'm fine. I've asked all mine.
Okay. Does anybody else want to come in with any questions now? Now me and Caroline have had our bit. Everybody's quiet.
I come in. I always do, don't I?
Hi, Caroline.
Hi, yeah. You know, we're very much in favour of a licensing scheme. You know, we do feel that it's the business that should take, you know, the ownership, because they're actually the person that has the most to gain or the most to lose. So they should be their responsibility for meeting any, you know, breaches. They're the best people to in track to keep an eye on the people in the salon. You know, there's such a turnover of staff in beauty and aesthetic salons, and particularly they also have self-employed staff within the salons as well. If it's a business level, then that could cover self-employed individuals as part of the licensing check scheme. I think it's about premises inspection, you know, infection control, you know, all the first aid, anaphylactic shock management, complications training, all the things across the board. It would also ensure that people have the appropriate qualifications and training for what they actually do. They have the appropriate insurance. It will also check that they've got the right to work, and it would look at combat modern slavery as well. As part of it. So there's a whole raft of things that are really in favour of a licensing scheme.
Yeah, I'm with you there.
Thanks, Caroline. Well, if that's everybody's questions, I will bring this session to a close, because I know that we're all a bit pushed for time today. So thank you very, very much. It was a really informative session and very focused. So thank you to all our speakers today. And if you've got any other comments or questions that you want to forward to us, please do email it to my office or to the Secretariat. So this session will be made available online, and the Secretariat will share that link once it is ready. And we'll also make the minutes of this session available and publish it on the APPG website. So thank you ever so much, everybody. That was really, really very informative session. I found it really helpful. Thank you. Take care. Bye.
Thanks all. Bye.